Hi everybody, it's Dr. John Hayes. You're listening to 95.9 WATD. This is Beating Neuropathy and Chronic Pain. I have on the phone with me today from sunny California my good friend and confidant Russ McCann. Russ, welcome back to today's show.
Thank you so much for having me. It's been my privilege.
You know, Russ, before we cut to the break, we're talking about metabolic syndrome, which for those of you who are joining us late really is a whole series of things. And let me just go through the rundown here. Metabolic syndrome is a constellation, if you will, or a group of risk factors. Risk factors primarily for diabetes, stroke, heart disease, and probably more than one form of cancer. Number one is a large waistline, especially carrying weight around the midsection of the body. Number two is an elevated triglyceride level, which is a measurement of a certain blood fat, which we're going to talk about in a moment. Number three is a low level of HDL, which is classically referred to as the good cholesterol. Next is hypertension or high blood pressure, and then last but not least is high fasting blood sugar. Now, Russ, one of the things that I wanted to get across is something that I see in practice, and I'm making this a very, very important point because it's something that not only that I see in my clinic, but unfortunately I see the same mistake being made with physicians. And that is this, is that oftentimes what happens is we too often assume in our society that when we have somebody or we ourselves or a family member who is ill, that some of what we're experiencing is just a consequence of normal aging. A lot of this whole idea that, well, you're 45 now, so it's okay for you to be 20 pounds overweight, and now you need the high blood pressure medication. Well, it won't be too long before you need this medication and that type of thing. Well, that's just normal. The fact of the matter is, for a lot of people, and I would submit respectfully on this show that for most of us that is simply not true.
Right.
But the problem is that as a clinician, what I see time after time after time is that in the clinic, oftentimes we fail to look at the trends. In other words, if I have a patient who's presented to me with chronic pain, but most especially neuropathy, one of the first things I do is I go back and I take a look at their laboratory records. And what I do is I get their medical records from the previous 5 years released, especially in a patient I'm trying to make a diagnosis on. And Russ, I can't tell you how many times if we just take a look at the trends. In other words, we take a look at the patient's body weight, we take a look at their blood pressure, and we take a look at their abnormal or their changes in their blood sugar. Sometimes these patients with metabolic syndrome are still on the upper end of what's considered normal, but they are in fact very, very sick. So, the bottom line is even just being, 10, 15, and then, 20 pounds overweight can have a very, very significant impact on our health. So that's why this whole thing about metabolic syndrome is so very, very important to understand.